everyone. Thank you for coming to join us in this important webinar today on migraine. With us today is Dr. Maggie Waung, and we want to thank Dr. Waung for taking time off her busy schedule to come and talk to the community about her specialty on migraines. Welcome, Dr. Waung. 歡迎幫介紹。
Thank you so much, Diane, for inviting me to this forum. I am very excited to talk about migraine with you all, and especially migraine in older patients. So 大家好，我係汪慧敏，我好開心同你哋講關於偏頭痛，呢個係我第一次講中文。Let's start off with a case. I saw this 71-year-old woman in clinic. Actually, someone called me about their grandmother who had a history of high blood pressure, high cholesterol, prediabetes, who had developed some dizziness and headache in the evening. This was after she'd spent a pretty long day in the park with her grandson, so maybe she was a little bit dehydrated. So 女子佢有高膽固醇、高血壓 and then 少少糖尿病。夜晚黑佢同佢個 grandson 玩 all day and 夜晚黑就覺得頭痛有少少暈。呢個係佢第一次覺得暈同埋頭痛一齊。佢話俾佢嘅家人聽，佢想瞓低瞓覺眯埋眼，佢覺得佢會好返啲。She said this was the first time she'd ever felt dizzy and she just wanted to lie down in a dark room. So what do you think her family should do given the situation?
咁啲家人應該點樣做啊？
This is what I told my friend, to bring her to the emergency room right away. So especially for 老人家係好多嘢嚴重嘢可以令到頭痛。It's very important that for the first time headache, that's a new headache, and dizziness also, that she get evaluated right away. And the main concern that we would be worried about is stroke. So 我哋最擔心或者佢有 like 血性中風啊，或者 even 出血性中風. So both of those, either an ischemic or hemorrhagic stroke, is very concerning. Luckily, she went to the ER, she got a CT scan to rule out any bleeding and an MRI brain, and that was normal, and that ruled out stroke. So after the FIUM, she also got Dinlo, Somio, and Chilik Gongzhen that were normal. So 嗰啲醫生俾佢 IV fluids. She got IV fluids and IV medications for her 頭痛 and for her nausea. And she started feeling a little bit better. After a couple hours, then she was discharged home. So it was good. So even though she had to wait in the emergency room for a long time, I would say it's worth it just to have a peace of mind and to make sure that there's nothing wrong that's happening in the brain. And whenever an older person, and even though we don't think of it as old, 50 years old is sort of the cutoff for an older person. There are more considerations that we think about for someone who has headache who's older. The most scary conditions we think about are like the hemorrhage, the bleeding in the brain, or even aneurysm bursting in the brain could cause headache. And then there's also a condition where there's inflammation of the arteries that can happen, usually in older patients, called giant cell arteritis. This condition usually causes a headache on one side of the head, usually over the temples, might also cause some vision changes in that eye. And then there's also brain tumor, which can cause headaches. Brain tumors can slowly grow over time, and that can start to, once it gets to a certain size, it can start causing headaches. Also in older people, they're more susceptible to these conditions like medication overuse headache, where when you take too much medication like aspirin or Tylenol or ibuprofen, that can actually lead to worse headaches. And then there's also hypnic headache, which is headaches that come out of sleep. So sleeping seems to cause a headache, whether it's sleeping at night or when you're taking a nap. Then there's these other conditions that can cause transient neurologic symptoms that can sometimes be associated with headache. These are the mini strokes or transient ischemic attacks. And then seizures can also rarely present with headaches as well. In addition to like 中風低啲也可以令到頭痛 and 老人家係嗰啲血管去個腦可以有啲發炎，或者腦裏邊或者有一個瘤or some sort of tumor， 用太多藥都可以令到頭痛。And then 有時呢啲細中風或者發作都可以令到頭痛。Once we've ruled everything else out, the most common cause of severe headache that is bothersome is migraine. And so what is migraine? 偏頭痛係乜嘢? It turns out that migraines are more than just pain in the head. They can cause a lot of different symptoms. It's not just headache. So 偏頭痛唔係淨係喺個頭，我會話俾你聽 other types of symptoms that can be associated with the headache. The most common symptom of migraine is the moderate to severe headache that really causes you to stop what you're doing, or at least really interferes with what you're doing. These headaches tend to last for anywhere from 4 hours, a couple hours, to even a couple days. 偏頭痛可以幾個鐘頭啊，或可以有幾日都可以last. And then oftentimes headaches are triggered by changes in the environment or changes in your body. So common triggers are things like dehydration, overactivity, or weather changes. 天氣變啊，唔夠飲得唔夠水啊，or 或者玩得太犀利都可以令到偏頭痛。Generally, migraines tend to be on one side, although this is a pretty soft rule. Usually one side tends to be worse, but once it gets severe, the headache can go to both sides. 兩邊都可以，但係通常係一邊就痛啲，比較痛啲。And then the pain quality of the headache tends to be like pulsating or throbbing. I was telling you that migraine headache can be more than just the head pain, and it can be associated with sensitivity to any type of stimulus, whether it be light, sound, or movement. And then there also can be associated nausea or vomiting, poor concentration. People say they can't think well. They might have dizziness too. 偏頭痛都可以令到唔舒服啊，如果太光或太大聲嗰啲嘢就唔舒服，或可以作嘔，諗嘢諗得唔係好，或者暈暈陀陀都可以 come with 偏頭痛。And this I thought was a nice diagram of migraine before even the headache pain starts. Right here, you can already start to notice changes. So before you even get the headache, you might notice symptoms like yawning, changes in your mood. People might feel depressed. You might have some cravings, like feel like you want to eat some chocolate. Or maybe need to go to the bathroom more frequently. You might start to have that sensitivity to sound and light. And then some migraine patients start to have some maybe tearing or runny nose or some more sweating in the face or facial flushing. That can all happen even before the headache starts in a migraine. And then the most well-known premonitory symptom of migraine is a visual aura, which is a visual disturbance that people usually describe as colored lights, or it might be dark spots in their vision. Typically, they spread across the vision slowly and last for about 20 minutes. And then during the headache, of course, you have the nausea, vomiting, and the throbbing headache. And then when the headache is gone, you still might have some additional symptoms like feeling tired for a day, still feeling not quite yourself, not back to normal yet. And that can last even up to 2 days after the headache is gone. 頭痛之前可以感覺到呢 like 唔舒服啊，或者想食朱古力啊，或者頭痛之前就覺得嗰啲燈太光啊，或者太大聲，出邊太大聲。頭痛之後咧，可以覺得冇 energy 諗嘢，諗唔清楚。And even though migraine we think of commonly as affecting people who are younger, it's good to keep in mind that migraine still affects people, even older patients. So this is a plot of people who have migraine and based on their age. And you can see that there's a peak of migraine in people, really from their 20s to their 60s. But children, as young as 5 can get migraines, and then adults as old as 100 can still have migraine. So that's something to keep in mind. And migraine doesn't just affect females, it also affects males. And this is a pretty high percentage. This is 15 to 20% of people get migraines. And if you think about it, that means for every 4 to 5 people one of them has a migraine. And the other thing is that migraine tends to change as people age. When older patients get migraine, the features of the migraine change. So the headache tends to affect both sides of the head. And then older patients also tend to have more autonomic symptoms like facial flushing or rapid heartbeat with the headache. The visual aura I was telling you about with the vision changes, that tends to happen more in older patients. And sometimes older patients can even get just the visual symptom without the headache. That's more common in patients who have headache that are over 50 compared to the younger patients that have migraine in their 20s and 30s. This is a schematic of, this was a neurologist who back in 1940, he drew his visual aura. So this is after, when it first started, this was what his symptom looked like. And as the time, 3 minutes, 7 minutes, and 10 minutes, this is what his aura expanded to look like. The aura doesn't follow this rate. A lot of people commonly describe the aura progressing over 10 to 20 minutes. And there is some basis for this when people looked at how depression waves spread in different animal models. You can sort of plot out along the brain how a wave of activity kind of spreads across the brain to cause this type of visual pattern. And that wave is then followed by a more longer wave of depressed activity. And so that's what we think causes visual aura. Another type of migraine, which may or may not be associated with headache, again, is vestibular migraine, which is a migraine that's associated with dizziness. I find that sometimes it's really hard to understand what people mean when they say dizziness, especially in Chinese. There's really only a few words to describe dizziness, so like one or one to to. That can mean the same thing as someone who feels like they're about to faint, and that can also be similar to someone who feels like something is spinning. Maybe the spinning is more like tao jun. Sometimes it's really hard to get a good description of vertigo. And so vertigo can be associated with migraine, especially when it just comes on suddenly and lasts for several hours. If there's some sort of dizziness that lasts for a few seconds to minutes, then that might be an inner ear problem. But whenever you have dizziness that's going on for several hours, that makes me think of migraine. Oftentimes, if you have an inner ear problem, that can also cause dizziness when you change your head position. But it's good to keep in mind that migraine can also worsen when you change your head. So it can be kind of tricky to separate those things out. Another common symptom people say is a visually induced dizziness, or for example, when they're driving down the highway, all that motion that they see that can cause dizziness, or if they're shopping in a shopping mall and they're passing all those aisles, that can trigger dizziness, and that often can be related to migraine. And finally, any head motion can trigger dizziness. Anyone who has vestibular migraine, when they move their head, that can worsen dizziness again. And again, it's really hard to distinguish sometimes between an inner ear problem versus a migraine problem that's more centered in the head. There are other manifestations of migraine outside of the headache, which is hemiplegic migraine, which is a migraine associated with weakness on one side of the body. And that's important to figure out because those people are more susceptible to developing a stroke. So we want to watch those patients a little bit more carefully. We want to avoid certain medications in treating patients with hemiplegic migraine. And then migraine with brainstem aura has some overlap with vestibular migraine in that you can get dizziness, but you can also get symptoms like trouble hearing or ringing in the ears or some speech difficulties, some slurred speech. That's migraine with brainstem aura. 有其他種偏頭痛，另外一種咧係叫 hemiplegic 偏頭痛，
即係偏頭痛有埋一邊身係癱咗嘅，即係唔喐。
But it's temporary, so 淨係幾個鐘頭，一邊唔喐得。And 呢個係頭痛同埋或者講嘢講得唔係幾好啊，暈暈陀陀都可以。
即係頭痛，如果夾埋係或者係一邊身唔喐得啊，或者係講嘢講得唔好啊，或者係有啲暈陀嗰啲，呢啲咁嘅偏頭痛嘅症狀咧，即係可能要即刻要去急症室嗰度查清楚，到底係偏頭痛抑或係中風。
Yeah, what causes migraine? 乜嘢令到偏頭痛? The short answer is that we don't know what causes migraine, but we do have some clues. We know that genetics plays a big role in migraine. 我哋唔知道what causes 偏頭痛，但係我知道有可以遺傳俾仔女啊 because most people who have migraine have a first degree relative that also has migraine, either father, mother, daughter, son, or that's very strong correlation. Although a lot of times people think, oh, they just have headaches. They don't realize that those headaches are migraines. It's a higher genetic prevalence than people think.
即係呢個偏頭痛咧，我哋以為係嗰啲人就咁偏頭痛咧，但係如果問清楚啲咧，原來咧嗰啲人有偏頭痛嘅人咧，通常咧就或者係父母啊，或者兄弟姊妹啊，都有偏頭痛嘅。即係呢個喺呢個遺傳方面咧，係非常之普遍嘅情形嚟嘅。
Yeah, and we do also have known genes that can cause migraine too. So there are certain rare genes that people can inherit that definitely cause migraine. A lot of these genes are in proteins that control firing in the brain. They control both the function of the neurons and also they control how well blood vessels work.
因為呢啲遺傳嘅基因啊，啲醫生已經揾到㗎啦。咁咧，呢啲基因咧就喺個人嗰度啦，係唔止係會引起偏頭痛咁簡單嘅，因為呢啲基因咧可能係控制佢嘅神經嗰啲細胞啊，同埋嗰啲血管嘅擴張啊咁樣，所以咧喺偏頭痛裏邊咧都有其他嘅症狀嘅，就好似嗰啲憂鬱症嘅焦慮症咁，同埋或者係喐嗰啲啦。都可能係即係過度活動嗰啲人咧，都係有遺傳性嘅。咁即係嗰啲基因可能就係通通都係有聯繫嘅，就係偏頭痛嘅遺傳率咧都係高咯。即係如果係父母有嘅，嗰個仔女有偏頭痛嘅機會咧，係10個之中係有4個會有嘅，4成啊。
You know, I told you migraine is more than just headache, and it's because of all the symptoms, we really suspect that migraine involves a lot of different parts of the brain. And we have a lot of studies that support this. So imaging studies looking at different activation patterns in the brain before and during headache show that there's a lot of different regions in the brain that change during migraine. And that these changes in the brain are related to some of the pain's input, like pain input from the neck. So, this is input from the eyes, both mechanically and also from light. And then also some input from the blood vessels just around the head. That seems to also interact with headache. 我哋覺得偏頭痛係腦裏邊有
不同嘅地方腦嗰度。
and then 有呢度腦裏邊有影響出邊嚟頸啊或者眼 or 嗰啲血管頭嗰啲血管。
紅色嗰啲代表乜嘢？
Red areas are areas in the brain that have high activity. And this is a study looking at even before the headache starts. These areas, if we look in these areas, they're active.
即係當時譬如個病人話：我即係嗰啲光好殘眼啊，或者係哇好大聲啊咁，你喺個腦嗰度咧就見到有呢個紅點啊，嗰個紅點不同嘅位置咁，係咪咁啊？
So we think that those symptoms are really being triggered by different activations in the brain.
因為而家睇到咧，就係當個病人喺度話有咩症狀嘅時候咧，啲醫生咧照一同佢個腦做嗰啲電腦掃描咧，就已經係睇到個腦裏邊咧嗰啲有某一個地方嘅某一個部分嘅細胞咧就會係光咗出嚟嘅，就係紅色、橙紅色嗰啲地方。咁咧就佢講唔同嘅症狀咧，就不同嘅位置會出現嘅，所以啲醫生咧就可以整到一個咁嘅路線圖啦，知道如果你嗰度着咗咧，你就係會即係同呢啲症狀有關噶啦咁。
Even though we don't know everything and exactly why migraines occur, we have some ideas of how to treat migraine, and we have a lot more treatments today than we had even 5 years ago. 我哋而家有多啲治療嘅方法，多啲藥可以
即係你有好多種藥可以俾啲病人試嘅，可唔可以幫到個偏頭痛
？But the first thing to do is to really think about what you could change yourself before starting medications. And these are some lifestyle changes that anyone can make who has headaches. 個個人有偏頭痛都可以諗下佢哋點可以自己幫助佢嗰啲頭痛。So the first thing is to try to keep a regular schedule as much as possible, including sleeping at the same time, waking up at the same time every day, even on weekends, and then eating a regular meal schedule, not skipping meals. 食嘢啊，瞓覺要每日時間都唔好變太多，定時間。Make sure that you're well hydrated, that you don't become dehydrated. So especially if you're outside and it's hot, you want to make sure you're drinking plenty of water. So say都飲好多水，
唔好缺水。
A lot of people have noticed triggers, like if they eat too much salty food or certain meats, that can trigger headaches. So avoiding that type of thing or being out too much in the sun can also cause headaches. So trying to avoid doing those types of activities.
即係要自己有頭痛、偏頭痛嗰啲人要自己要叫做心水清，要知道係自己做咗啲咩嘢啊，而引起偏頭痛咧，就做少啲嗰樣嘢，或者係唔好俾嗰樣嘢發生啊。即係如果係好熱啊，咁你咪唔好出街咯。如果係你要出街咁，你要帶定多啲水，唔好缺水。尤其是有啲地方天氣好熱，我哋三藩市唔會好熱啦，但係有啲地方而家已經好熱噶啦，所以大家要小心。
運動都好重要。So regular exercise is really important. And that's showing to be important to reduce headaches and pain conditions and good for brain health too. So not all the medications we use for headache are approved by the FDA. We use a lot of medications off-label to treat medications, but this is the list of all the medications that are approved by the FDA.
都好多種藥喎，有成七八九種藥可以。呢啲係個美國食品藥物管理局係批准咗係要嚟偏頭痛嘅藥，但係其他仲有啲藥啲醫生係用嚟做偏頭痛嘅，但係未得 FDA 批准嗰啲叫做 off-label use，即係唔係指定用嗰個嚟做偏頭痛嘅，但係佢哋發覺係可以用嚟醫偏頭痛嘅藥。
Yeah, and you can see that even just looking back 10 years ago, we only had, 8 different medications or treatments for migraine. So, in the past decade, we've pretty much doubled the number of medications we have for migraine.
你嗰度每個 triangle 每一個三角形咧，就係代表一種藥，一隻藥。即係你都冇寫細晒佢啲名出嚟嘅，唔係得咁少名嘅。所以見到近住呢10年，即係2020年嗰度咧，就係一大堆藥，即係嗰啲藥物發展得好快，最近呢10年吓。
Yeah, in the past 10 years. Just to give you an idea of how slowly research works is that these new medications block a peptide called CGRP. And we first identified CGRP in 1980. 1980
40年前咯喎。
Yeah, and then 10 years later, we found that CGRP seems to be involved in headache, because this was a paper that showed that when you measured CGRP in patients during a migraine, that it's higher. And so it's only 30 years later that we start to have these medications finally, and they work really well.
即係呢隻藥咧，呢隻 CGRP 啦嘅藥名啦。1980年嘅時候，佢哋已經知道呢隻藥可能會幫到頭痛噶啦。咁喺10年嘅期間咧，已經係發覺佢哋係真係可以幫到頭痛喎咁。但係要經過呢個藥物管理局嚟到正式批准啊，仲要等多30年，到2020年嘅時候先至批准嘅，即係到嗰陣時咁上下先批准嘅。所以嗰個過程啊，真係好漫長啦。Not every medication is the same.
Yeah, that's right. In addition to that list, we have a lot of different medications we use. And when we treat migraine, we treat it in 2 different ways. The first treatments we have are medications we take as needed as soon as the headache starts. And these are some of the examples of medications we use. A lot of these are just general pain medications like naproxen, ibuprofen, aspirin that people can take as soon as the headache starts.
Do they wait for the headache to start, or if they sense the aura that they should take it then?
If people do get the aura, we always recommend that you take abortive medication as soon as you feel the aura, and that might help abort the headache phase of the migraine. Because the aura, we feel like, is this cortical spreading depression, and if you can stop it early, then you can sometimes stop the headache from forming. The triptans are medications that came out, let's see, the first sumatriptan was in around 1990, and these are migraine-specific medications, so they only help for migraine. They don't really help with neck pain or back pain, and they seem very targeted towards migraine. There are other medications that are used for nausea, and remember, nausea is associated with headache, but it seems like these anti-nausea medications also can stop the headache portion of the migraine. We'll talk about some of the devices that are used for headache, and then these are some of the abortive CGRP inhibitors. And then I also should point out that opioids, we've done studies now showing that even though opioids might temporarily calm down the headache, that almost always, if you use opioids, headaches will tend to come back. So we don't recommend using opioids to treat migraine. And then anytime you use these medications more than 2 or 3 times a week, you run the risk of causing worsening or more frequent headaches. 呢啲藥係你有頭痛嗰陣時即刻食呢啲藥，但係如果你食得太多，每日食可以令到你嗰啲頭痛
頭痛會增加，食得太多藥。
And then I think it's important not to use opioids for migraine.
即係唔好食嗰啲鴉片類嘅藥物咯。如果係鴉片類嘅藥物咧，食咗咧就正話汪醫生講咧，就係短暫咁樣佢可能即係你冇頭痛咧，因為佢係止痛啊嘛。但係一過咗之後咧，嗰啲頭痛就即刻翻嚟噶啦。咁所以呢個鴉片類嘅藥物咧嚟到醫呢個偏頭痛咧，唔係幾有用嘅。
What do you do if you have more than 2 or 3 headaches per week, but you can't use those abortive treatments more than 2 or 3 times a week? That's when we start someone on a daily medication to try to prevent the headaches from happening. 如果頭痛 as 每日都有頭痛咁，我哋usually will recommend 開另外一個藥令到 so your headaches won't occur. And these are some of the classes of medications that we'll use. And you can see there's a lot of different types that we can go through. There's also some vitamins that have been shown to help that we could try. And then I should also point out Botox injections, which I'll talk about a little bit later, and the newer medications, these CGRP monoclonal antibodies, these are monthly injections that you can do at home. You can give yourself an injection and that helps calm migraines down.
You know, people take Botox for different things, for cosmetic reasons too, right? So for those individuals who happen to have reasons to take Botox for cosmetic reasons, as well as having migraines, they could go for it, right?
So that was how Botox was even first developed, was that it was started as cosmetic treatment, and the people who are getting Botox for their wrinkles noticed that their headaches got better. So that's what prompted doctors to look into it to see, does it help? And so now we've had these 2 large trials showing that Botox does reduce migraine. It actually works for many people. And it's not a problem to use both Botox for migraine and cosmetically. There is an upper limit of how much Botox we want to use. We usually give Botox every 3 months. And so it's just important if you are using it cosmetically, just to let your doctor know so that we don't exceed that limit. But I would say most people don't exceed it if you're using it cosmetically. And then in terms of treating older patients, there are a lot of other considerations that we think about. First of all, sometimes we don't think of migraine in older patients because of that curve. We think that migraines tend to improve with older patients, but we forget that older patients can still have migraine. Older patients sometimes do have a lot of pain, so they may be using a lot of Tylenol, or they may be using opioids for other conditions. And so that makes treating migraine challenging, because if someone is using medications, a lot of times the medications we use for migraine don't work as well. If they're also, older patients have more medical conditions, so are on more medications, and so a lot of medications can interfere with some of the migraine treatments.
咁即係老人家對呢個如果佢哋有偏頭痛咧，係一個對醫生嚟講係一個好大嘅挑戰嚟嘅嚇。因為佢哋已經用咗咁多藥啦，佢嗰啲藥其中有可能係有一啲已經係有嗰啲止痛藥喺裏邊噶啦，嗰啲止痛藥又未必係可以幫到醫頭痛，但係你又要再加啲醫頭痛嘅藥落去，咁即係可能啲藥物用得太多啦，翻用咁用得太多藥物，咁佢其實又有其他嘅症狀啦，可能係心臟病啊、中風嗰啲病史啦，咁加上嚟咧，你即係連佢去係咪真係偏頭痛咧，都即係要係好小心咁樣先至去認證到確認到佢呢個係偏頭痛。咁可能係偏頭痛，可能唔係，係咪？咁即係嗰啲醫生佢可能都唔去睇醫生咯。咁有時就即係可能係有偏頭痛都唔知道。
我哋要好小心揀藥and to諗下。
So you are a migraine specialist. But patients don't come and see you in the beginning. They are referred to you. So 就係嗰啲其他嗰啲普通科醫生咧， 佢哋要知道個病人係偏頭痛，佢哋覺得係即係控制唔到啦，先至嚟揾你，係咪咁啊？
Luckily, in neurology at UCSF, there are many people who can see headache. We have our general neurologist and also our headache group that can see headache. But we are also working on educating primary care doctors about how to treat headache, especially in the elderly, and things to think about. But I would say if you are suffering from headaches, just ask your primary care provider to refer to a neurologist because it's important to try to treat the headache as soon as possible.
咁而家就即係在座各位咧，就可能要大家又做一個醒目嘅病人啦。因為有時咧，你去睇醫生嘅時候咧，睇家庭科嘅醫生嘅時候，佢哋可能好忙嘅。你話頭痛咁，佢覺得可能冇咩嘢嘅，咁即係唔知道係影響你嘅生活咁犀利咯。咁就算你話，哎呀，我日日都痛啊咁佢咪又係俾啲止痛藥你食咯。咁但係你如果係覺得係嗰啲止痛藥冇效，係你嗰啲頭痛仲係日日都有嘅時候咧，你係要叫你嘅醫生，你要叫個家庭醫生，你話我可唔可以去睇一啲專醫頭痛科嘅醫生啊？咁樣嗰啲頭痛科嘅醫生咧，通常咧係一啲腦神經嘅醫生嚟嘅，就係好似阿汪醫生咁樣啦。但係你哋係要識去叫咯，有時真係你如果唔自己去叫咧，啲醫生係唔會特登又寫張推薦書俾你去睇另外一個偏頭痛嘅醫生嘅，即係你當時亦都唔知佢係咪偏頭痛，你只係但係要去睇一個專醫頭痛嘅醫生先至會查得到出嚟咯，所以呢個係大家要留意一下啦。
Okay. And so here is a slide talking more about Botox. This is just an illustration of where we inject the Botox. And this might help a little bit with the forehead wrinkles, but probably isn't going to help too much with wrinkles. But this is the standard injection sites that we use for Botox. If it's helpful, we can repeat the Botox every 3 months. But it's also good to keep in mind that Botox isn't going to work right away like some of the medications. It can take 2 to 3 rounds before it starts improving headaches. But if it does help, that effect tends to stay and doesn't wear off over time. And then the other benefit of Botox is that it doesn't interact with any of the medications. So I think it could be really helpful for older patients. There are some side effects, like you might get some drooping of the eyebrows or eyelids, but as long as the person who's doing the Botox is pretty careful, we can avoid that.
So they should come to you or, doctors like you yourself to get the Botox treatment. Going to a cosmetic place to get the Botox may not be getting it in the right place. Is that correct?
Exactly. Yeah. They might not know this protocol for headaches.
So where the white dots are, so it's not like, I want to get it for my face, then I can, and the wrinkles around the lips, I can get the Botox around the lips. So it's not like that.
Mm-hmm.
You have to get in the right place.
Yeah.
Or else it doesn't work as well.
Mm-hmm.
OK. 咁咧，各位留意啊，因為咧呢啲 Botox 咧，佢唔係一打就見效㗎，佢可能要打2-3次先見效。咁你諗下啦，3個月打一次，打2-3次要即係等成6個月啊，先至會見效喎。即係其中嘅嗰段時間啊，你仲要食住啲止痛藥嗰啲嘢啊嘛。咁所以咧就即係唔好話我打咗都冇用嘅，唔打啦咁。你要記住佢係唔係一打就有效嘅 ，OK？ 咁所以咧你係要有耐心啲，打佢2-3次啊。咁但係好處咧就係當佢有效嘅時候咧，佢就真係有效，可以同你維持幾個月，係唔會有呢個偏頭痛嘅。咁所以咧就而且咧佢咧唔會同其他嗰啲藥發生呢個互動嘅關係嘅化學作用啦。咁即係比較安全啲，同埋咧就因為佢係可以留喺個身體嗰度耐啲咧，佢即係可以幫到你呢個冇偏頭痛呢個時間咧係可以長啲嘅。咁所以可以即係可以去試下咯，但係就唔係去嗰啲美容院試，係要去揾啲頭痛醫生試。
Yeah.
Can the regular family doctors, do they know how to do this?
Some of them may know how to do this, but I think most don't. Usually I've seen mostly neurologists or pain doctors do this protocol.
都係要揾神經科嘅專科醫生，醫頭痛嘅專科醫生嚇。
Yeah, but the good thing is since Botox is FDA approved and it works well, I've never had a problem with it not being approved by insurance as long as we meet certain criteria. So it usually is covered by insurance.
即係多數院所會同你俾呢個錢，即係唔同你去美容去打 Botox 咁啊，院所梗係唔同你俾錢啦。但係如果你呢個係要嚟醫頭痛咁樣去打呢個 Botox 咧，咁個院所係會同你俾錢，多數院所。
And then in addition to medications, there are some devices that are being used for migraine. The problem with all the devices, which I'll talk about, are when they are not covered by insurance. Although that might change in the upcoming years. But so expense is a big thing. But what I do like about these devices is that for elderly patients, again, it's not a medication that you're adding on and that it could be helping without using medications. So the first device that is used for headache is called e-neura, or transmagnetic stimulation. So this gives a very strong magnetic pulse and seems to be most helpful for patients who have migraine with aura. The idea is that pulse stops the aura from spreading and causing headache.
So the patient has to hold it on the back of the head like that?
Yeah, so as soon as they get the aura, they hold it on the back and they push a button. And that stops the headache. So instead of taking the abortive medication, they can use this strong magnetic stimulator. It can't be used if you have like a stimulator or a pacemaker, unfortunately.
Oh, that's important. 咁各位朋友咧，呢個咧，尤其是老人家咧，係可以唔食藥咧，係可以用呢啲咁嘅電器啊，細嘅電器咧，係幫你停咗呢個偏頭痛嘅。咁如果當個偏頭痛你一發覺佢有啲先兆嘅時候咧，你就將呢嚿嘢咧，呢嚿嘢可能要自己用錢買，院所可能唔包嘅。咁咧就擺喺個腦後邊，咁咧撳嗰個掣開咗佢啦。咁一陣間咧，嗰啲偏頭痛就會走噶啦。咁呢個比食藥係比較好嘅。因為唔會擔心話食得太多藥啊，或者係過重啊咁樣樣係咪？咁咧就唯一唔好處就係要可能自己俾錢咯。How expensive is something like this?
They were charging about $1,000 a month for unlimited use, but I haven't looked into how expensive it is more recently.
So you mean it's not, you don't just buy it?
You can't just buy it. Yeah, they charge you by month. Yeah.
That's expensive, huh?
Yeah.
可能呢個租俾你嘅咋，買唔到嘅話，即係可能每個月租俾你，咁然後就大概收費大概1000蚊一個月度，都相當貴。
Yeah. This one you can buy. It's cost about $500. And you don't need a prescription for it. You can just buy it on your own. This can be both a abortive, so you can use it as soon as the headache starts, but you can also use it like every day as a preventive. So some people use it in the morning or use it at night before they go to bed.
And how long do they have to keep it on?
Usually it's about 20 minutes, 15 to 20 minutes, and then you just stick it on your forehead.
咁呢個咧就係擺喺個眼眉上邊嗰個位嘅，咁咧嗰個即係個眼眶上面嗰個位咧，係呢個另外一個神經刺激器咧，就細個啲，呢個可以買喎，呢個買咗可以自己用啦，咁就可以日日用都得，咁你就擺喺個額頭嗰度咧，大概擺20分鐘度。So this one they have to pay themselves too, right?
Yeah. It's about $500.
呢個就大概平啲啊，呢個500蚊。Does it depend on what type of migraine they have?
Yeah.
Location and that where you put it where the headache is?
That's a great question. This one specifically stimulates the supraorbital nerves, which are the nerves that come out of the eye. And so I feel like this is better for those patients whose headaches are more happening in the front of the head.
咁即係可能你決定買邊個嘅時候咧， 就要睇下你個頭痛啊係邊個位置。即係汪醫生覺得咧，如果係個頭痛係喺一個額頭嗰度嗰啲位置嘅咧，咁呢個刺激器咧就可能會有用啲。
This one stimulates a nerve that goes down the neck called the vagus nerve. This device actually is best for a different type of headache called cluster headache, but some patients with migraine find benefit. I like to use this device more patients who have more dizziness or have more, like sometimes people who have more nausea and GI symptoms might respond to this more. This one also is like a rental basis.
Oh, this is also rental?
Yeah.
Does it cost also $1,000 a month?
I think it's closer to $300 a month.
呢個又係租得嘅，300蚊一個月到喎。咁呢個咧就係俾一啲嗰啲症狀有係頭暈啊或者作嘔啊嗰啲咁嘅症狀。因為其實呢條 vagus nerve 咧叫做迷走神經，其實我唔知點解佢個翻譯叫做迷走神經，好得意啊！咁咧呢個迷走神經咧嗰條神經啊，其實係一路由個腦嗰度咧一路駁落個胃嗰度嘅，所以咧係有胃嗰啲咁嘅症狀咧。呢個咁嘅迷走神經刺激器咧就有用啦，即係你作嘔啊、作悶啊、頭暈啊嗰啲咁咧就汪醫生咧就多數會用呢個咁嘅神經器落嗰個俾個病人試用嘅。
This is the newest device that's been out. It's called Relivion. It also stimulates the supraorbital nerves, but this is the only device that stimulates the greater occipital nerve, so the nerves in the back of the head. And this is nice. This used to be a rent model, but they have moved to a rent to buy model. That might be better for some people.
即係呢個咧，你可以租，亦都可以租咗去買咗佢都得。呢個就係俾前額啦，前額有頭痛嗰啲，或者係甚至個後腦有頭痛嗰啲，即係浸住瞓嗰個位啊，有頭痛嗰啲人都可以用嘅。
Yeah, and this one can be used also both as an abortive when you have the headache and as a preventive.
呢個可以預防又得，但係你如果係有偏頭痛啦，佢亦都可以將個偏頭痛停止嘅。
And then the final one is Nerivio. We really like this using this in our pediatric patients, but this is as needed. And the idea is you're stimulating some pain fibers in the arm, and that causes your brain to release pain signals or activate and reduce headache pain. So by stimulating outside the head, it reduces head pain.
呢個就好得意喎，呢個擺喺隻手嗰度啊。汪醫生話最好就係，如果細路仔有偏頭痛，呢個最啱細路仔用。咁你就喺擺喺隻手嗰度咧，就可以刺激個手臂嗰啲神經，刺激個手臂嘅神經咧就會駁到去個腦嗰度，就刺激個腦度嗰度嘅神經，咁就會將呢個偏頭痛係控制到嘅。
Well, that's all the devices and treatments that we use for migraine. And to summarize, we should all remember that migraine can occur in older patients. But before we diagnose migraine, we have to make sure that nothing else is causing headache. So it is important to make sure we get some type of imaging or workup to make sure nothing else is causing headaches. And then migraine is a complex genetic brain disorder that people are still very interested in figuring out what exactly causes headache and migraine and why it affects people some ways and not others. And finally, it's really important to treat migraine both safely and effectively. And this is important because if you don't treat migraine, it can get worse over time. And then if you overtreat it with the wrong medications, that can also worsen headache. 偏頭痛可以影響老人家，唔係淨係年輕人。我哋先要做測試啊，to
睇下有冇其他原因。
Yeah, exactly. And then 偏頭痛係
複雜啦嚇，一個好複雜嘅遺傳性嚇。
如果有偏頭痛，睇醫生啊，食藥可以控制到，唔好令到佢影響你個。
即係唔好影響生活。It's really brought up an important point, and that is that a lot of people with headaches, you know, how we are pretty resilient and we say, oh, it's just a little headache, you know, comes and goes, and you know, I'll just bear with it and not really take good care of it. 即係好多人有頭痛咧就唔理嘅，唔去睇醫生，一來冇時間啦，翻工可能咩，咁咧就帶住啲頭痛翻工，頭痛即係唔係好犀利嘅時候咧，就勉勉強強咁。即係整到個生活嘅質素好差嘅，但係咧就唔知道原來即係呢個偏頭痛咧可以醫，同埋咧即係呢個偏頭痛係一個相當嚴重嘅病嚟嘅，咁所以你如果唔醫咧，可能係越嚟越痛，越搞越壞咁，即係變咗係始終第一句就係病向淺中醫。你如果係初初少痛嘅時候唔醫佢，佢就越嚟越痛。多謝汪醫生。如果係睇 YouTube 嘅時候俾啲 like 啦。OK， 咁多謝各位參加，咁啊，到下次有講座嘅時候再話俾你哋聽啦。Thank you so much.
So thank you for inviting me.
No, thank you.
Yeah.
So bye bye everyone.
Okay,
Thanks
bye.
again. Okay, bye bye.